Let's begin the discussion with initial thoughts. Dr. Vidal, please present your arguments.
I strongly advocate for proceeding with the surgery as it is grounded in core ethical principles and supported by both deontological and utilitarian perspectives. First, beneficence obligates us to act in the best interest of the patient. The critical period for language acquisition is finite, and each month without auditory input diminishes this child's ability to develop spoken language. This deficit will have far-reaching consequences affecting their education, relationship, and overall quality of life. From a deontological standpoint, our duty as healthcare providers is to prioritize this child's well-being and ensure they have the opportunity to acquire language during this critical developmental window. Delaying the surgery will fail to uphold this ethical responsibility. The principle of justice further supports the urgency for this procedure. Justice demands equitable access to care, recognizing that not all elective procedures are created equal. Cochlear implant surgery for a child in this developmental stage is not merely elective, it is time-sensitive. By reclassifying this as an essential intervention, we uphold the child's right to necessary medical care. Equating the surgery with purely elective or cosmetic procedures neglects the profound and lasting impact on the child's ability to communicate and participate fully in society. Finally, under the principle of non-maleficence, delaying the surgery introduces greater harm than proceeding with it. The risk associated with COVID-19 can be effectively mitigated through rigorous safety protocols, including pre-operative testing, PPE for healthcare staff, and isolated facilities. From a utilitarian perspective, the long-term benefits of the surgery, improved communication skills, educational opportunities, and social integration far outweigh the manageable short-term risks. Proceeding with the surgery not only ensures critical care for this child, but also maximizes their future potential and overall quality of life.
Thank you, Dr. Vidal. Dr. Redding, please present your arguments.
While I acknowledge the significance of this child's case, the national health pandemic compels us to prioritize the broader ethical responsibilities. Under the principle of non-maleficence, we are obligated to avoid harm not only to the patient, but also the healthcare workers, hospital staff, and other patients there. Proceeding with a non-emergency surgery during this time increases the risk of COVID-19 exposure, potentially exacerbating the public health crisis. These resources required for this procedure, including the operating room, time, PPE, and medical personnel, could be redirected to managing the critical COVID-19 cases and saving lives. The principle of justice also demands careful consideration. In a pandemic context, equitable resource allocation means prioritizing interventions that address immediate and life-threatening conditions. While cochlear implant surgery is important, it does not qualify as urgent when compared to the needs of critically ill COVID-19 patients. Diverting finite resources to this surgery risks compromising the care available for those in life-threatening situations, which undermines fairness and our collective responsibility to the broader community. Additionally, the principle of solidarity, a cornerstone of public health ethics, calls on us to act collectively to protect society's most vulnerable members. Delaying this surgery temporarily aligns with this principle, ensuring that we allocate resources and attention where they are most urgently needed. From both a utilitarian and deontological perspectives, the decision to postpone the surgery reflects our commitment to minimizing harm, supporting public health, and prioritizing the greater good for the greatest number.
Thank you, Dr. Redding. Each team now has 2 minutes to confer and respond to the other team's arguments. Dr. Vidal, how do you respond?
Dr. Redding raises important concerns about resource allocation, but it is essential to recognize that cochlear implant surgery requires a specialized team and equipment separate from those used in COVID-19 care. This procedure does not significantly impact the critical resources needed for a pandemic response. Delaying the surgery, however, has profound and permanent consequences for the child, as a critical period for language development is finite. Under the principle of beneficence, our obligation is to prevent irreversible harm, which outweighs temporary resource considerations. The principle of autonomy also supports proceeding with the surgery. The parents have made an informed decision to move forward, fully understanding the risks involved. Respecting their choice aligns with our ethical duty to uphold patient rights and honor their role in determining what is best for their child. This autonomy is especially significant when the stakes involve the child's long-term ability to communicate and engage with the world. Finally, alternatives such as sign language or auditory therapy, while helpful, are not equivalent to the outcomes achieved with cochlear implantation. From a utilitarian perspective, the long-term societal benefits of this surgery are substantial. A child who acquires spoken language skills will likely require fewer resources for special education and communication support, benefiting both the individual and the broader community. With strict COVID-19 precautions, the manageable risks to healthcare workers and others are justified by the profound and lasting benefits for the child and their family.
Thank you, Dr. Vidal. Dr. Redding, please respond.
Dr. Vidal, while I understand the urgency of this child's case, it is crucial to consider our broader obligations as healthcare providers. The principle of non-maleficence extends beyond the individual to include protecting healthcare workers, other patients, and the community. Even with rigorous precautions, hospitals cannot guarantee COVID-free environment, and proceeding with non-emergency surgeries during a pandemic introduces unnecessary risk. Temporary delays in cochlear implantation, though challenging, align with our ethical responsibility to minimize them. From the perspective of justice, we must evaluate the societal implications of our decisions. Approving this surgery now could set a precedent for reclassifying other elective procedures as essential, straining hospital resources that are already stretched thin. In a pandemic, equitable resource allocation means prioritizing life-threatening and urgent cases. While this surgery is significant, it is not immediately life-saving and can be delayed without permanent harm if alternative measures are implemented. Furthermore, the principle of autonomy cannot override public health considerations in this context. While the parent's perspective is important, we must act in the interest of the greater good. Alternative interventions, such as auditory therapy or sign language instruction, can help bridge that gap until the surgery can proceed safely. This approach respects the child's immediate needs while safeguarding the public's health and ensuring that limited resources are directed where they are needed most.
Thank you, Dr. Redding. Each team now has 2 minutes to confer and provide your final arguments.
Before closing, I'd like to respond to Dr. Redding's previous comment. Alternative measures cannot replace the unique benefits of cochlear implantation during this critical development window. Sign language and therapy are supportive but do not provide auditory access necessary for spoken language acquisition. Delaying surgery risks closing this window forever. In closing, the ethical principles of beneficence and deontology compel us to act now to protect this child's ability to acquire spoken language during their critical developmental window. Delaying surgery risks irreversible harm to their communication abilities, ultimately impacting education, relationships, and quality of life. This is not simply an elective procedure. It addresses a unique and time-sensitive developmental need that cannot wait without significant consequences. From a utilitarian perspective, the long-term benefits of proceeding with the surgery far outweigh the manageable risks. A child who acquires spoken language skills will gain independence and require fewer societal resources, creating lasting benefits for their family and the community. With rigorous COVID-19 precautions, including testing, PPE, and infection control measures, we can ensure the surgery is conducted safely while protecting public health. Our healthcare system must adapt to crises without neglecting critical needs. This surgery exemplifies a case where action now prevents permanent harm later. By proceeding, we fulfill our ethical obligations to the child and their family, ensuring a brighter future without compromising the safety of our healthcare teams or the community.
Thank you, Dr. Vidal. Dr. Redding, your final arguments.
While I deeply empathize with the child's situation, we cannot overlook the broader ethical responsibilities imposed by the pandemic. Under the principle of non-maleficence, we must prioritize minimizing unnecessary risk to healthcare workers, patients, and the community. Justice, further demands that we allocate limited resources fairly, ensuring they are available for those in immediate life-threatening conditions. Approving this surgery now would undermine these critical principles. From a utilitarian perspective, postponing this procedure maximizes the overall good by safeguarding hospital resources and protecting the public health. Temporary delays, while not ideal, are a necessary compromise to ensure fairness and focus on the most urgent cases. Alternative interventions, such as auditory therapy or sign language, can help support the child's development in the interim without exposing others to unnecessary risk. Deontologically, our duty extends beyond individual cases to uphold policies that protect the collective well-being. Delaying this surgery aligns with our moral obligation to act responsibly during a crisis. While difficult, this decision reflects a commitment to balancing the child's needs with the broader ethical imperatives of fairness, safety, and public health.